Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello, I'm Dr. Shruti Venugopalan, ENT surgeon and head and neck surgeon from Shakuntal ENT Clinic, Vadodara. So today's topic is, why do nausea and vomiting occur with vertigo? Of all the symptoms that come with vertigo, nausea is often the hardest to deal with. The spinning is unsettling, but the nausea, sometimes strong enough to cause vomiting, is what can make an episode feel overwhelming. And for many people, that part isn't explained clearly enough. Today, we are breaking this down. That is, why vertigo makes you feel sick, what's happening inside your body, and what actually helps. Let's start with the core question. Why does spinning lead to nausea? The answer lies in something called sensory conflict. Your brain relies on four systems to understand balance: the inner ear, the eyes, the brain and your nervous system, and signals from your muscles and joints. When these systems agree, you feel stable. But when they send conflicting information, the brain struggles to interpret what's happening. In vertigo, the inner ear may signal movement while your eyes and body say you are still. That mismatch creates the spinning sensation and it also triggers nausea. But why nausea? Why vomiting? This response is actually hardwired into the brain. From an evolutionary perspective, when the brain receives confusing sensory signals, it may interpret this as a sign of toxicity or poisoning. So, it activates a protective response, which is nausea and vomiting. That's why vertigo can cause real intense vomiting, not just mild discomfort. It's not psychological, it's a deeply physical reflex. Not everyone experiences vertigo the same way, and a few key factors can make nausea more severe. First, the duration. Short episodes like BPPV, that is benign paroxysmal positional vertigo, may cause only brief nausea, but longer conditions like vestibular neuritis can keep the brain in a state of conflict for hours, leading to stronger symptoms. Second, individual sensitivity. If you get motion sickness very easily, you're more likely to experience severe nausea with vertigo. Third, anxiety. After one bad episode, the body can start anticipating the next one. That anticipation can amplify nausea even before the spinning fully begins. And this doesn't mean it's just an anxiety. It means the brain has learned to expect distress, and that expectation strengthens a real physical response. So, what can you actually do when nausea hits? Start simple. Lying still and closing your eyes can reduce sensory input, giving your brain less signals to process. Like a quiet, dark room can also help by lowering visual and environmental stimulation. Slow breathing, longer exhales can activate the calming part of your nervous system, helping reduce both stress and nausea. For milder symptoms, some people find ginger and lemon and other citrus fruits helpful. There is evidence that ginger and other citrus fruits can reduce nausea in certain settings, so it may be worth trying. For more severe symptoms, medication may be necessary. Doctors sometimes prescribe anti-nausea medicines like prochlorperazine or ondansetron. These can reduce nausea, but they don't treat the underlying cause of vertigo. There are also medications called vestibular suppressants which reduce the spinning sensation, but these are usually recommended only for short-term use. Why? Because long-term use can interfere with the brain's ability to adapt and recover. And if vomiting is severe enough that you can't keep fluids down, that might cause dehydration and can worsen dizziness and may require medical care. So let's summarize. First, nausea and vertigo is caused by sensory conflict, that is, a mismatch between what your brain is expecting and what it is receiving. Second, the nausea and vomiting are real protective reflexes, not something you have imagined. Three, simple strategies such as rest, reduced stimulation, and slow and mindful breathing can help in the moment, while medications may be needed for severe episodes for you to get prevented against dehydration. Now, because understanding what's happening doesn't just explain the symptom, it makes it easier to manage. This show is only for information and does not replace medical advice. If nausea or vertigo with vomiting is difficult to control, please speak with your doctor. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.